All right. Okay. So I presume most of you, I did a similar session before, like a couple of months ago, and some of you doctors were already part of it. And if anybody has not seen that, they can let me know, because I don't want to repeat the same thing. It doesn't make sense repeating the same thing. And I can share the link to that previous interview session, so you can watch that later on as well. But this interview session, I wanted to have it a little bit more advanced, a little bit different. So if anybody has question regarding the previous interview or something, like they have already like seen it, or any questions regarding that, they can ask. No question, guys? Okay, all right. So I'm just gonna run through it really quickly, what I said last time too. I would definitely suggest all of you guys who are using Zoom is that your interviews are gonna be on Zoom. So have a profile picture, like a headshot up there. It looks professional. It makes you look like somebody who uses Zoom, understand the professional ethics. So I would definitely suggest that after this session, when you go through the recording, make sure you put something of a professional headshot on Zoom. That really makes a lot of difference, especially when you're going in for an interview, like how Dr. Jaspreet has one from his modeling days. So, coming to the next part. Okay, so this is one of the things. So in my previous interview session, I told everybody that most of the 95% of the school will ask you questions regarding, tell me about yourself, your strength, your weakness, how do you manage strength, how do you manage leadership, like tell us about a time when you were in a leadership role, tell us about a time when you were in a group. So these are the basic, I would say, these are the basic standard questions that are asked everywhere. And if anybody wants to ask questions regarding this, they can, because I will try to touch upon some different type of questions which are as less, but they are still asked. So anybody has questions regarding these questions that I mentioned, like tell me about yourself, they can ask you about can you tell us about a strength in your personality, a weakness. They can ask you, tell us about a time when you failed in your life. Schools love to tell us about teamwork, because one of the things I keep telling or repeating is a lot of time schools want to make sure that we get a student who can work in a group and do not create fight or trouble for them. So they will one way or another ask you, have you ever worked in a team? Are you a good team player? Or some question regarding that. And then every school love to ask, why should we pick you as a candidate? So any questions? Do you guys have any question regarding this? I'm trying to make it a little bit more discussion based rather than me just speaking during this session. And you can unmute yourself if you want to speak. Yeah, you can just unmute yourself and speak, Doc. No need to raise hand.
Hi, good morning, sir. So my question, am I audible?
Yes, you're quite audible.
Awesome. So my question is, for questions regarding, I mean, we would like to cite examples in these generic questions, right? Where they're asking about our failure. What kind of examples or clinical failures? So what kind of examples should we do? Because they might ask a follow-up question like, what did you do to make it better or to improve?
So here's the thing, Doc. Okay. So they will one way or another. Okay, let's see this question. Let's zoom out a little bit. So schools can rephrase this, but they will ask you one way or another is, can you tell us about a time when you failed in your life? They can rephrase it and say, can you tell us about a time when you learned a lesson? Or they can say, tell us about a time when you had regret in your life. Now, these seemed very different questions, three different questions. But if you look at them closely, what the school is trying to listen or figure out is that is this person authentic enough? Is this person confident enough? Is this person open enough to share a story in their life where they failed? They want to make sure, because imagine you're somebody who did BDS, right? Right, doc, you did BDS back home. And imagine
Yes.
if you are working with your lower classmen, with your juniors, and somebody walks in and say, "Oh, sir, I've never failed," or "Madam, I've never failed in my life. I was the topper in my high school. I was the topper. I got accepted to 5 schools, and I've been the best of my class ever since." You will think in your head, "This person is a jerk. This is a pain in the
Mhm.
neck," right? So the
Yeah.
schools, dentist schools, in order to make sure that you're not a pain in the neck, you're not a arrogant, annoying person, will ask you a question where they want to see, can you share a vulnerability or a breaking point in your life. Now, the way I suggest is, don't jump into giving clinical answers right away unless they ask you. If they ask you to give us a clinical answer, then it's a different thing. But if they ask you, tell us about a failure, I would rather give an example from your life. It can be regarding some sports work. It can be regarding your academic failure, where you were in an exam, you failed the exam due to your health or due to your family circumstances. Maybe you were having difficulty passing TOEFL in the first, or not passing, but getting high score in TOEFL. So it could be this kind of situation. But I personally would hold back giving clinical examples right away, because you need to understand. All right. So, but I was saying, I would hold back giving clinical. Can you mute yourself? I'm sorry. Don't mind me saying it. Otherwise, I have to mute you guys one by one. But what I was saying is that I lost my train of thought. But here's the thing. I was saying, if you give clinical right away, a clinical example, trust me, the way clinical dentistry is done throughout the world, there's a lot of variation. Like, for example, in some part of the world, if you're doing a restoration and you don't put on a rubber dam, it's it's like below standard. In dental school, you have to put rubber dam when you're doing a restoration. Otherwise, you're below standard. But in the real world, in US, there's hardly very few people. If you worked as a dental assistant, they hardly put rubber dam. Nobody has that much time. They can use isovac, iso dry, they can put cotton rolls, something like that. But not everybody has the time to put on rubber dams for restorations. So, uh doc, just to answer it simply, if I have to give an example, I would rather say something non-clinical at first, unless they ask you. And one of the key things I'll tell you that you just asked is, whenever they ask you, tell us about a time when you had failure, tell us about a time when you had a regret, tell us about a time where you had a loss or difficulty, always tell them the problem, but spend more time in what you learned out of that problem. And if you, let me give you an example. If they ask me, tell us about a time when you suffered a loss, I would say, I'm just giving a random example. Back when I was playing, I used to play basketball for my dental school team. I substituted a couple of team players due to their performance. I felt they were not doing good enough, and I substituted them, and we ended up losing that match, and we ended up losing the whole tournament due to the decision I made. And later on, I realized that it was a mistake that I made. But one thing it taught me is that when you're a leader of a team, you have to own your mistake. You have to learn from them. And next time, whenever you're working in team, you can take guidance from your coaches, from your colleagues, to make better decision. But it's a learning process that I learned, and I hope to continue to use it as I move forward in my professional and personal life. So you can listen how I was focusing on failure, but then I emphasize more on what I learned from it. Does
Yeah.
that make sense?
Yes, sir. Thank you so much.
Okay. All right. There was somebody who asked something in the chat. How can we answer a failure question if we do not have one? Diversity related. Well, doc, one could, okay. If you guys want to unmute and say, it would be rather easier. But if you, here's the thing I'll tell you, Dr. can you unmute yourself if you're comfortable speaking in the mic?
Yes, doctor. Hi, how are you?
So I'm fine. So here's the thing. What year did you graduated from your dental school
I
back home?
graduated on 2022.
Okay.
And yeah,
Mhm.
please go ahead.
Go ahead.
I have like few mistakes, but I did not have like any big failure or
Okay.
something.
Here's the thing. Big or small mistake is a subjective word. Maybe you're working with a faculty in whose world, like even the simplest of things can be a very, very, very big mistake, right? Like in it's a subjective thing. Like in some people's world, not getting 100 out of 100 is a failure. And then there will be people like me who are backbenchers in whose universe, unless as long as you get 60 out of 100, you're passed. Nobody cares, right? So it's a subjective term. Now you're comparatively a fresh graduate, like 22 is still a fresh graduate. Now you
Yes.
have to look closely in your life, and right now in everybody, like in the whole group, I don't want to go into detail of your personal life, but if you start going through it, I can definitely tell you there will be 3 or 4 examples of failure. Maybe you don't look at them as a big failure, but for the sake of interview, when you will look at them, you will learn, okay, this was a kind of a failure. It could be a patient management failure. It could be, and usually when I talk to say failure word, people think, oh, I failed a biochemistry exam or I failed a mathematics exam. No, it's not just that. There's a lot of different type of failures we face as human beings. Now it depends how you want to probe or look into your life and find an example that you can relate to the school, because the school by the end of the day doesn't care about your, like, as long as you didn't kill the person in your dental school, they don't care about your what the exact story is. What they are trying to see is your personality type to communicate about any failure in your life. And are you open enough, are you authentic enough? Like, people, I worked with people, and we came down to the point where they didn't feel like they had any failure example, but then they told me, like, I came to US and it took me 3 exams just to get a license, driving license in LA, because it was so difficult. And I said, well, this is a kind of a failure for somebody who drove a car for 10 years back home. And now you came to this country, you thought you were a doctor and everything. And in the starting, you're not even able to pass the driving test. How much disappointment is that? So it depends on you. You can find small examples, like even finding a job as a dental assistant in the start can be a pain in the neck. So you can find examples like this in your story and use them for a failure example.
Yes, doctor. Thank you so much. It was really helpful.
Yeah. So I know comparatively, like if somebody of my age who's now 33, I can give you like 45 or more than that failure example, right? When you're younger, you have less, like, obviously you lived less, so you have less experiences and you have comparatively less examples of failure. But still, if you probe it deep, if you start to look at things, you can create a lot of examples out of small experiences you had. And I'm just sharing it with you. So when I was giving interview at Colorado, they were asking me question and I got pretty overconfident to the point where I was saying, oh, I did this. Like, Dr. Brown is a doctor who said, why should we pick you? I said, well, if you do that in the next 3 years, you will be really happy for this, or you will be really proud of the decision you made. And I was being a little bit overconfident because after 30 minutes of conversation, I felt like I can crack this joke. I did, but there was a Indian student, current student sitting in there who was like, okay, how about you tell us about a failure in your life? So he saw me that I was trying to be a little bit cocky or overconfident. I don't know whether cocky would be, but he saw it and he was like, just to bring me down or like show me a little bit taste of reality. He was like, okay, now tell us about a failure in your life. And I actually had to like think. I was like, oh, okay, well, there has been a lot of failures. Whether then I had to think about sports. And I was actually going to tell them, like, there have been so much failure in my life, whether it was relationships, friendships, whether it was so many things that you promise in your life that you were never able to keep up. And those are all the failures that you carry as a burden as you grow up in your life. And those were also part of failure. So you can come up with any example. It's all about brainstorming it. Does that make sense? Now,
Yes.
if you think about this, here's the key thing that I would encourage you to understand. Schools can flip the same question and say, tell us about a time when you had a regret, or tell us about a time when you dealt or you learned a lesson, or tell us about a time when you faced a difficulty. So now, if you look closely, you can use the same answer that you created out of your lives and answer any of them, because they are similar questions, just rephrased. Does that make sense?
Yes, it does. So can I mix the question, if I mention a time when I made a mistake for a failure, like kind of
But
tweaking a little bit?
what would be your example?
I had to think, but there are few mistakes that I
If
done
you,
in
I can,
patient.
I can tell, if you have an example right now that you want to share, I can help you. Like, I can tell you if you want to share.
Maybe can I share at the end of this video so that I
Okay,
can
it's
create a
fine. It's
story?
fine.
Yeah.
So totally up to you. So, Dr. Sava is asking, what about if we fail due to health issues? Yeah, so here's the thing. People who are fresh graduate, who graduated last 2 years ago, their life is very different. Like when I was 26, my life experience were very different as compared to when I'm 33. And now health issues, your commitments, your family lives, your financial situations, there's so many things that you can talk about. And I think you can always talk about health issues as long as you don't put, like, I had a severe neck injury, or I had a severe back injury, or severe wrist injury, because they will start thinking, well, this person had like a disc slip in their neck. If we even give them admission to the school, then they might start to have neck issues and might not be able to perform dentistry for very long. So in their head, they might start thinking, is this person physically capable enough if they have a chronic pain or a chronic issue? So you can talk about health issues. I'm just saying, I came across a lot of stories where mothers dealt with, like during pregnancy and stuff, they dealt with complications. There were people who dealt with cancer. But as long as you tell that I dealt with this problem and I'm glad that I recovered, but during that time of difficulty, I learned to be resilient. I learned to have a bigger faith in destiny, in God, and I was able to be grateful for whatever health I have right now. So it taught me the gratitude and not to take things for granted. So you can talk about a problem, but emphasize on what you learned out of that, like how it made you into a stronger person in life. Does that make sense? Dr.
Yes, thank you.
Sophie?
Thank you.
Okay. Yeah, so totally you can talk about health issues, that's fine. But as long as you don't, like, you phrase it well and don't make it, I tell people, don't make it into a sob story. Like, I talk to a lot of people who are coming from countries that are war stricken, where there was or they were refugees or things were going bad, whether it was Iraq, Ukraine, any country like these. What we discuss is that yes, there was war happening, there was difficulty, but whatever happened in my life made me into a stronger person that I am today. So you don't want to say, oh, I'm the biggest victim of life. Nobody likes victim mentality. You want to say, yes, things happened to me. I lost a loved one. I had some difficulty, but all of these experiences by the end of the day made me into a stronger person. All right. So, Dr. Jacqueline, you said that TOEFL failure. Yes, you can. Well, first of all, we don't fail in TOEFL, but yeah, we do fail to get good marks. Yes, and it depends on how you uh, elaborated. For example, I have friends who are coming from Taiwan, uh, from Latin, like South American countries where English is not like English, like for most countries like Pakistan, Egypt, India, they were colonies of British. So they have much more, their education system is in English. So for them, the dentistry was already taught in English. So for them, it's very easy to come past TOEFL and get into a dentist school. Now, for these other countries, it becomes a little bit more difficult, even some Middle Eastern countries. So I tell them, when you're saying your failure story, you can mention that when you moved to migrated to United States, one of the biggest thing was to relearn dentistry in English. And that's something Americans will appreciate, because if you ask them to go and learn dentistry in German, they will most probably say, no, we will quit dentistry rather than doing that. So when you tell them that I relearned dentistry in English, and then I had to pass my or get good score in my TOEFL exam, I had to take multiple attempts. But one of the things it taught me, that you have to be resilient, you have to plan properly, and you have to make sure you give in your best intent every time you go in. But here's the thing, if you're giving an example, you want to show that you made improvement. You don't want to say that first I had 77 score, now I have 79. So if you're telling a failure, you want to tell a story where you came out as a hero, as somebody stronger. You don't want to tell a story where you got beaten and you're still getting a beating. That doesn't make sense. Am I making sense what I'm saying? Or am I talking to myself up here? Dr. Jacqueline? Yes, doc, guys, listen. It would be easier if you guys can unmute and just say it, rather than, because I'm not able to, then I have to follow the chat a lot. So feel free to just unmute and speak.
Hi,
Doctor,
Doctor.
yes.
Actually, I have a question. What do you think about if we talk about the postpartum depression? Is it a good idea, or?
As long as you know how to phrase it, I think it's a real thing, and it re-changes the way you look at world. It re-changes your physical and mental capacity, and I think it's a valid thing. But again, you talk about it, but you want to talk about it in a way that makes you look like you came out as a stronger person.
Yes.
That's the whole thing. My only problem is I've worked with candidates who will end up telling a problem, and then they make it a therapy session. I tell them, this is an interview, this is not a therapy session. Talk about it. Like I don't know if you've seen on my, most of the time I'm very generous about talking about my dad's death and how it reshaped things. And I think it was one of the best things that happened to me. It is what it is. When things happen, you just own it and you learn out of it and you become a stronger person. So if you can tell a story, it can be your health related, and especially if you have an interviewer who's a female, they can understand this better. It's no joke. Even I learned even fathers get a postpartum as well, and well, it changes everything. And the point is that you can talk about it as long as you know how to elaborate it without making it looking like a therapy session.
Yes, thank you.
Sure. Any other question, guys?
Hi, Dr. William. Thank you so much for this session. So,
Yes.
Maida.
Yes, I know, I can see you up there. Maida's iPhone. Yeah.
Yeah. So, in some interviews, there are some ethical questions. I don't know how to prepare for that. Last year, in an interview, I was asked a question. Can you describe the situation where you were treated unfairly, and how did you deal with that situation? So how to answer?
What answer? Here's a question. At that given time, what did you give an answer?
I was blank for some time, and then I gave a very stupid answer. Like I said, I always felt like my mom loves my brother more. I couldn't think about that kind of answer at that time.
Okay. Yeah, it depends. It's okay. Well, if they ask you that were you treated somewhere differently,
Yeah.
I just feel, I don't know if you guys gonna agree with me, but I think in most part of the world, being a female person, you get a lot, you are at not exactly in US, but I'm talking about real like other part of the world where things are far more difficult, is that women even being a female, you're at much more disadvantage. The
Yeah.
opportunity you're given, like if you want to pursue a strenuous profession like surgery as a woman, the chances of you getting accepted, you have to work twice as hard as the men up there just to prove that you're competent enough to stand 8 hours in the OR or manage all the physical capacity. And this is something everybody knows this, like in the surgery world, that it's far more like it's a men's world when it comes to surgery. And it's not just surgery, a lot of other aspects in the world as well. So yes, you can always talk about like being a woman. There's certain times that you have to deal with this thing. But again, even as a man, you can give examples where in sports you were not tall enough and somebody else was made the basketball team captain, even though you felt you played better than them. It's fine. It happens. What you do is you just work harder to prove who you are, because by the end of the day, your real competition is the yesterday you. So that's how I would rephrase it. That and I know a lot of people are religious minorities in their countries, uh,
Yeah.
ethnic minorities. Again, and my answer, like I'm a universal minority. I'm a Pakistani Christian. Wherever I go in US, I'm an ethnic minority. In Pakistan, I'm a religious minority. But the point is, and they ask me, how do you manage feedback? I said, well, it depends where the feedback is coming from. And if it's a constructive thing, I just take it as it is. If it's somebody who's just saying it out of an anger or grudge or discrimination, I just ignore it and I continue to work on the things I need to and work harder, because by the end of the day, my competition is with myself. So is life fair? No. But what do? You just work harder and just perform your best. So just to briefly tell you this answer, you can always give the answer that yes, as grown-ups throughout our life, there are times when you're at a disadvantage where there's favoritism, there's bias. In my dentist school, I wanted to perform more get more surgical experience, but as a female, it was really competitive and it was difficult to even get more exposure in the surgery clinic. But what I've learned, that in order to make my space, in order to show my competence, I spend more time in my didactic, spend more time reading articles, keeping myself up to date. So whenever the professor asked a question, I would show that I've done my hard work. And eventually it got to the point where they started to give me more opportunity in clinical rotations of surgery. Does
Yeah.
helps?
Good. Thank you so much for that.
Sure. And I don't know if you're aware, but I made about, I don't know, 10 videos about ethical scenarios on my YouTube channel. Like there's a whole playlist. I've since past 3 years I've been making those. So those can help you too.
Yeah.
And
Look into that too. Thank you so much for that.
sure, yeah, that's up there already, a lot of stuff. But and it's a whole playlist. I've been trying to make a playlist. But one thing I'll tell you is that for everybody, and what I wanted to discuss more is ethical scenarios during this session, is that every ethical scenario, you might feel there are 10,000 of them, but they are not. If you start looking at them closely, there are about 4 or 5 principles they like to ask, and they just put different scenarios on top of it or rephrase it. For example, one ethical scenario you guys will hear a lot is regarding patient confidentiality. Now they can ask you, is one of your patient is HIV positive, but mentions you that they have not told their spouse who is sitting outside. What they are trying to listen is, do you know the importance of patient confidentiality in US? Now, the principle is same, but the question can be, you were working in a hospital, you went into an elevator, there were 2 nurses who were discussing about the detail of a patient. Now, do you think this is a violation? And what will you do? Again, the answer would be, this is a patient's patient confidentiality is being breached, and I will talk to them and I will encourage them not to do it. But if they continue to do it, I'll inform the concerning authority, right? Now, the same principle can be rephrased and said, if one of, and I made video on that too, that one of your, and I got this question at USC MMI, is that one of your staff member, your office manager, you're a dentist, the owner dentist, she comes to you and tell you that there was a USB stick which had all the patient's data, and she took it out with her at last night and she dropped it and can't find it. So she lost all the data. So in that case, what will you do? So the answer is, first of all, you will try to find that USB stick with your staff member, go to her car in our office, whatever, wherever it could be, look for it. If you can't find it, then you need to inform the concerning authority of the government regarding this potential breach. And you also need to inform the patients that your data can be potentially breached. And if something happens, let us know. Thirdly, you want to have a meeting with your staff and ask them, why did this happen in the first place? Why was the patient data being taken outside of the office? And what can we do in order to prevent it in future? So I know I'm speaking a lot right now, but the point is, if you listen to these three different scenarios, the scenarios are different, the situation is different, but the logos, like the main thing that they are trying to listen is, do you understand the importance of patient confidentiality in the US? Does that make sense? Guys, does it make sense?
Yes, doctor.
Okay.
Yes, sir.
So, Dr. Evangelina, you're saying, how can we answer if we, Doc, you guys can open up the mic and just say it takes far difficulty to go into the chat. But if we failed NBD part 1 and then pass INBD, okay. So Dr. Evangelina, you there?
Yes,
Fine,
doctor.
sorry.
Can you hear me?
Yes, I can. So you're saying, yeah, what you're saying, I've heard this before. There were people. Now, you said if we failed one of the board exam and then later on passed the other one, right?
Right.
So imagine if you're in an interview, and some of you guys who are listening to this, you might have failed your NBD 1 attempt or failed your National Board Part 2 1 attempt, whatever it is. You need to realize they saw this already in your resume, in your application, and they still called you for an interview, right? Does that make sense? So number one
Right.
thing, you need to understand, this is a problem that they are already aware of, and they somewhat accepted you partially for the interview because they are fine with this failure, right? So mentally, you need to understand that they are already aware of your flaw. Now they are giving you an opportunity to explain what happened. Because as a teacher, as a professor, as an academic individual, all of us know as humans we fail, but we are willing to forgive the failures where somebody learned a lesson from it and made it into a strength. For example, if I'm just making this hypothetical, if I failed my National Board Part 1 and then later on passed my INBD and got an invite, even before they ask me a question, I would one way or another say this, that when I moved to United States in 2017, 18, 19, whatever year it was, I was very energized. I wanted to pursue my passion. I wanted to pursue dentistry. But one of the things I did not calculate it, that I was overwhelming myself with a lot of responsibilities. I was doing dental shadowing. I was managing family. I was doing volunteer work. And along with that, I was also giving my National Board Part 1. And unfortunately, I did not pass my first attempt. But it was a blessing in disguise because it taught me the importance of preparation and it taught me the seriousness or the hard work that I need to put in to pursue dentistry in US. So this was a hard blow that I faced right on in my starting journey of dentistry. But after that, one of the things I did was I took days off from my work. I sat down for a couple of months and I prepared very hard to pass my board exams. And I was fortunate that in my INBD first attempt, I passed. But one of the best thing that happened to me was that it made me take my education more seriously. It taught me the importance of resilience, and most importantly, it taught me the importance of preparation in life. So now as I move forward in my life, I will continue to use these principles to improve my professional and personal life.
Okay.
Does that make sense?
Oh, yes. Thank you so much for the example.
Sure. And remember, you guys need to understand, unless again you made a mistake, like you killed somebody or you like did a very big blunder, by the end of the day, we as humans, we all screw up. I'm just saying, like we all do in relationships, in life, in education. But the point is, we are willing to forgive and give second chance to people who show that they have a potential to be better human. That's a very, there are people in the group who would have kids, right? And your kids make stupid mistake and break things all the time. And I'm not, or somebody might be a teacher or an aunt. You're willing to give them second chance because you see a potential of good, that this person can learn from his mistake and actually can be better. And that's a very deep ingrained emotion in all the human beings. So if you can tap into that and tell them, listen, I failed, I'm not perfect, and I'm willing to accept it, but I'm most importantly willing to work hard on it if you give me the opportunity. And that's the kind of student they are looking for. They aren't looking for Mr. Perfect, and they are not looking for Einsteins, because those are a pain in the neck. Those are very hard people to teach. So they are actually looking for people who have dealt failure and who are willing to learn from that. Makes
Thank you,
Hi,
Doc.
Doc.
Makes
Hope
sense?
you're doing good. I have a question. What if they ask, why should we choose you? What will you bring to the college or the university?
This is Dr. Who's this? Sorry,
Smriti.
I
This
can't.
is Smriti.
Yeah,
Yeah.
I can just read SS. Okay.
Yeah.
All right. So first, go ahead. You tell me your answer. If they ask you, this is some. Imagine if I'm a school committee, right? So if I ask you this question, how would you answer this?
I think I'm good with my work. I can bring a lot of things. For example, I know many languages. I can help many overseas students to understand if anything comes up like that. Also, I know a bit of things which, we do in dentistry and like something like that. I'm not sure of. That's why I'm asking, doctor.
Okay. Now, if you want me to help you with this answer, I would need some details from you. So, where did you graduated from? India, right?
I'm from India. I did my BDS from India.
In
Yes,
what year?
and now sorry,
In what year did you graduated from India?
I graduated in 2022.
Okay, and then after that?
After that, I did like practice. I practiced in India, and now I have shadowed in New York, and I'm currently in New York, like applying for schools.
Okay. And you said you speak many languages. What does many mean?
Like, which includes Hindi, English, that obviously, Punjabi, and a bit of French, like just the basics, the beginner level.
Okay.
Maybe like there may
Okay.
be
Okay.
students.
And any volunteer work that you have done?
Volunteer, yes, in India, yes, I've done. I have like attended camps and old age home. One, it was a workshop for menstrual women. I was a part of that too. So yeah, a bit.
I would definitely suggest also do volunteer work in US. That makes a lot of difference. That's something that they are looking into, like especially Red Cross and these kind of organizations. So
Mhm.
next question is, you said, what part of India did you grow up in?
I graduated from Bangalore, but I
Oh,
worked in
you grew
Haryana.
okay, so you're from Haryana. That's what I'm asking. Like, where did you grow up?
Yeah,
Okay, so
yes,
you're from Haryana. So you moved to a whole different part of India to go for your
yes, to go now.
education. Anything
Hmm.
else in your life or in your application or in your personal story that you find is important that you have done or you would like to mention?
Um, I think moving to US was a big decision because leaving everything there and coming to pursue because I wanted to pursue dentistry here. So maybe that.
Was there anything in your dental school that you feel like mentioning, any achievement, any conferences, any extracurricular activities, anything that,
I was cricket team captain and I also used to play volleyball, throw ball and many sports there and won awards in that too. Also I was ranked in the university top rank holder. So
okay. And okay, personally, like I would like to have more information regarding you, but it would require a longer time. But if I was you and they ask you, why should we pick you as a candidate, or they can ask you, why should we pick you over other people, I would say, I believe I would be a constructive team player or a good fit for your institution if given the opportunity because of my past experience. Not only did I get to graduate from a really good dental school in south of India, but through my personal experience of living in diversity. I grew up in northern part of India, but during my dental school, I moved to a whole different part of India, which had a different culture, different language, and a different environment. And it was quite a transition at an early age to go through it, but it gave me more resilience. It taught me to appreciate diversity. And I would say during my university days, I got better in my sports. I was a captain for my cricket team, used to play volleyball for women. And this kind of taught me a really good foundational understanding about teamwork, about working with people from coming from different background, different temperaments, different ethnicity. Beside this, I think moving to US, especially surviving in a city like New York, because they say if you can survive New York, you can survive anywhere. This was a very, I
mhm,
would say, harsh, but
mhm,
a good learning in my life. And since the past 1 year, I've been doing dental shadowing. I've been volunteering with Mission of Mercy or Give Kids a Smile. And I think my biggest attribute that I can bring on the table is my ability to be a good team player while pursuing excellence in my field. So again, the amount of information that you gave me, this is how I would carve out your answer.
mhm. Thank you so much, Rock. It was really helpful. And also, what are some of the points which we can mention when they ask about ourselves? Like, tell us about yourself. What are the points that we should tell?
Let me tell you. I was reading a book and I would definitely suggest to read this. Everybody,
Mm-hmm.
there's a book and it's free on Google, so you don't even have to spend money. It's called The Artist's Way. The Artist's Way. So in this book I was reading, there was somebody called Michelangelo. He was a artist from Italy, and he wrote down that he made a very beautiful statue of King David, like the Jewish prophet, Christian prophet David, right? And people ask him, how did he made it? He said, when I used to look at the stone, I thought David was already in it. I was just freeing him. Like I was just carving out to free him. And one of the things I've learned last night reading that book, and we dentists are kind of somewhat in an artistic realm, is that when you think about that, I have to invent something new, it's not possible. A lot of writers who are writing books, they get in trouble because they have to think, they think they need to invent an idea or invent a book, and you can't think of something new, which you can't. But when you realize that there is or something is already there, and I'm just a channel of nature or the world who's going to figure it out, it becomes much more easier. The book's name is The Artist's Way. The Artist's way. So it talks to you about how to look at things artistically a little bit. So in your answer, like, let's figure out. So I'm going to tell you, you already have a very good answer, but I'm going to ask you a few things about your life. If you're comfortable, whatever you're comfortable telling me. So you said you grew up in Haryana. And if you don't mind me asking, what profession were your parents in?
I would love to discuss this after maybe the recording is off.
Okay, it's fine. I'm gonna make a hypothetical answer now. All right.
Sure.
This
Yeah.
because I'm going through this discussion, I'm gonna create a hypothetical candidate.
Sure.
Like, oh, actually, you know what? You can lie. Just if you're comfortable, you can give any random facts and make up a character. So I'm just to make your life easier, I'm going to create a hypothetical. So imagine if this is a candidate, she or he is from Haryana, all right? They have 7 siblings, all right?
Okay, so
Parents
let me just tell it myself. It's okay. My father is a businessman and my mother is a homemaker. My
Mhm.
brother is an engineer. He's a software engineer.
So here's a quick question, Doc. One of the most
Mm-hmm.
important thing you told me was your sports life. You
Mm-hmm.
there's a lot of candidates who, okay, when I'm listening to somebody, I'm
Mm-hmm.
trying to figure out what's unique about them. In your case, most of the candidates that I talk to are from India and are female, right? But
Yes.
not everybody is a sportsman. And even if they are a sportsman, they are not at a sportsman level where they are cricket team captains and they are rank holders. So that puts you into a unique position. So my question is, how come you were so much involved in sports, even though Haryana is famous for sports, but
Yes, I would like to answer that. Since a very young age, I was into it, but just at the school level,
Mhm,
not at state or something. I just wanted and liked to participate in different events, be it dance, singing, or sports. So that thing I started very young. When I
mhm,
was in college, because I used to love cricket and play better
mhm,
than others, I would say. So, like, much better. So, my sir made me captain, like, okay, we have to play and you be the captain. When I was captain for the first year, then for the rest of my BDS journey, I
mhm.
was the one.
Okay.
So, that's how it happened.
So here's the next question. How did you landed up in dentistry?
Dentistry, I was very keen about medical.
Okay.
Honestly, I wanted to be an
Mhm,
MBBS,
mhm,
but it didn't work out for me. Then
mhm.
I took admission into BDS because that was something I wanted to do, but not as much as I wanted MBBS.
You know,
So,
here's a thing, and it's an honest fact. Most people, at least from India, Pakistan, there are two kind of people who go into dentistry. One who wanted to be a medical doctor and couldn't get in, and
that's
the second are
correct.
people whose parents are dentists. Those are the only kids
Mhm.
who wanted to be the dentist. But
Yes, so there were at back of my mind, I wanted to be, but not as much. It was like 51 and 49
okay,
kind of a thing.
okay. So that's fine. That's totally common. But my question is, how did you landed up in South, in like Bangalore side?
Because I liked Bangalore and
But
I wanted to be it on the that side. And also it's not my like personal choice that I wanted that particular college, but it was through the seats.
so when you moved up there, now Haryana is a very different environment, culture. The dynamics are different. How was your like assimilation into that new culture or getting used to it? Was it any
It was
different or
it
was
was
it?
a difficult one, to be honest, because first the language was a barrier, but I feel the people there were very welcoming. So
Mhm.
I faced a bit challenges, but it was like it made me a person who I am today. Because I
Can you
think when
tell me
I
one difficult challenge in dental school or anything that you had to deal?
dental school at some time, I think that even teachers favored the ones who were from there and speak
Mhm,
those native language.
mhm, mhm.
So
Okay.
but then I thought that if I do better and perform better, then yeah, why not? Then I got my chance. So it was
So
happy.
what made you think about coming to US and pursuing DDS?
I was keen, actually. I wanted to learn from here
So
because there are many technologies involved and
So you graduated
dentistry.
in 22, and when did you move to US?
23 December.
Okay. All right. So did you practice there in India?
Actually, I haven't moved to US. I am just staying for a
Visiting.
bit. Yeah.
So currently
Um,
you're back in India, you're practicing, right?
yes. Yes.
Okay. And you're volunteering or shadowing in a dental clinic, right?
Yes, I did actually last year. Right
So
now I'm not,
what
but I
what
did.
kind of a clinic was it? Like
I
general
did,
practice, endodontics, what kind of a practice was
it
it?
was a general practice.
And
It was
what
a
kind of
general,
procedures were they doing up there?
pretty much everything. Like in US, you're asking about, right?
Yes. So
Yeah.
quickly tell me if there was one patient or one case or one procedure that you saw that was unique or different or you still remember.
I think it's about the way of doing cases because back in India, where I used to practice, there wasn't any advanced technologies, and how we do the procedure is a bit different. Over
Okay.
here, the patient education and the hygiene level, and also how you talk to the patient is completely different.
Okay.
It changed my perspective about dentistry.
Okay. Now I'm gonna briefly, I don't want to go into too much detail and for several reasons, but uh how do you pronounce your name again, Doc?
It's Smriti,
Sm-
Smriti,
Smithy?
Smriti,
Smriti. Okay.
SMRITI.
Okay. Sorry if
Yes,
I'm gonna say it wrong, all right?
that's all right.
But
No
if
worries. Yeah.
I would be you and they will, and it's for everybody, like everybody who's watching this or listening right now, just see how I was trying to extract like raw material from her life. So if I would answer this, I would say, thank you for giving me this opportunity. My name is Smriti. I was born and raised in northern part of India from a city called Haryana, which is very much well known for its sports background. It produces the largest or the highest number of wrestlers in India. So growing up in that environment, I was very much influenced by my brother and my father as well, who was very much devoted in sports. And at an early age, I got a hang of cricket, and I saw that I was actually doing good in it. And one thing led to another. That during my high school, I got to play for my uh, team. Uh, like women cricket team, and I became the captain. And this was an area which led me to playing more sports, working with my hands, and it allowed me to form good mind muscle coordination as well. And one thing led to another. My love for dentistry came into implementation when I got accepted to a really good dental school, but this was on the other part of India, which is South India in Bangalore. And once when I got accepted, I had to move up there. And at start, I was very much excited, but after my gradual process up there during my first year, dental school learning was one part, but along with that, getting assimilated in a new culture, getting used to the food, the language, learning the dynamics of the society was a learning curve for me. But one of the things I've learned is that if you continue to work hard and be honest, you can build a lot of relationships, you can build a lot of bonds with people if you continue to be respectful towards their core values. And that was the one thing that helped me get assimilated in that area and learn a lot from my faculty, from my colleagues. And I would say I truly enjoyed my time studying in a different state in India. But after my graduation, I moved back. And since the past 2 years, I've been working as a general dentist in a small town where I get to do a lot of restorative, prosthodontic dentistry, and surgical extractions as well. But I personally felt there's more to life. I wanted to grow, I wanted to learn. And because of that, I've been researching for the past 2 years for advanced standing DDS. And last year, I had the opportunity to shadow a general dentist in Long Island or Queens in New York for 8 months, where I got to see how dentistry is done differently in the United States. I got to see the importance of patient confidentiality, how technology is used like 3D scanning, lasers, and using technology like CAD CAM. And I believe all of these different experience has molded me in a certain way that would allow me to be a lifelong learner if I get accepted at your institution. So again, this was just I didn't went into too much detail, but this is when I was listening to your story, this is the kind of tell me about yourself I will try to make, or try to, like, my way of looking at it, tell me about yourself, is like a trailer to your life. If your life was a book, this will be the contents. Now, here's the thing I want everybody to listen. Whatever you say in your tell me about yourself or in the starting, you are laying down a map in their brain. So most of the next questions will come out of whatever you just told them. So you said these are some of the differences I learned in dentistry in US and India. The next question would be, tell us what's the differences that have you learned, right? Or they can ask you, tell us about a strength or a teamwork. And you can actually use your sports story to elaborate the same thing. So whatever you just said in your tell me about yourself, imagine if your house has 7 doors, 1, 2, 3, 4, 5, 6, 7, and you just showed them 7 doors. Now they will ask what's in door number 3. You will open it up and you will elaborate that story. So this way, you are in control or in power of your interview more than them, because you already planned the stories, what you're going to tell them, and you mention them in your tell me about yourself. So you're leading the way rather than they leading the way. Does that make sense to everybody?
Yes, yes, it does. And what if you have it in you, but you are not able to perform that well? Like, what if they misjudge you or something like that happens?
Well, that's this is something you have to practice. This is that's more detailed discussion, but this is where you have to practice. And I didn't go into detail. I haven't read your personal statement, but this is where you practice, and you have to. It takes a little bit practice, but you get to the point where you have to be wise with your words. You have to be, because you can confuse people and create problems for yourself.
Yes,
All
that
right.
makes sense.
So if somebody else was asking a question, I know rest of the people got bored out of this, but somebody was asking a question. Dr. Surbi?
Yeah, Dr.Adriel, yeah, hi. I have a follow-up question on this tell me more about yourself question. We have already shared so much about ourselves in the CV, the SOP, in the supplemental application, right? Especially if we get an interview call from a college that is open book or open file. So how should we make it? Should we make it, firstly, should we make it different from whatever is already been submitted to the program? And secondly, how should we make it fresh or new?
Microwave it for a few hours. Okay. Okay. Here's a question, Doc. What year did you graduate in?
2018.
So you graduated in 2018. I graduated in 2013. So you might be approximately like 5 years junior,
Yeah.
or whatever the word would be. So in the professional life. So I believe so in that whatever 26 to 28 years of your life that you have spent, you have so many experience that are beyond your resume and your personal statement. So if you think you've already given up or told them everything that you have lived and done in that resume or and that SOP, that's not true. If you explore your life, there will be, like, for example, in her story, one of the things I tell everybody, your origin matters a lot. That's the key thing that needs to be worked out. When I'm listening to somebody's story, like at her story, when she said Haryana, well, I never lived in India, right? But I watch a lot of Indian movies, Indian media. I've been influenced with it. I know Haryana, and Haryana is famous for all the movies like Dangal, for wrestling and all of that stuff. So you have to think, okay, so, and her sports life. So you have to create some kind of uniqueness to the origin. And you have to think about it. And everybody, like, who's sitting up here, if you think about it, you will find something that is unique to your life, or you did something different, and you can try to connect it to your story. So one of the things I say is, you tell me about yourself. The most important part will be your origin. how you go through that, how you start your story. That makes a lot of, because then people can relate with you. And the way you just make it fresh is, I don't have a formula. It's just you listen. I personally, I just listen to people's story, like, and you find something different. For example, if you want to tell me about what's your story like, I can just give you points. What would be an important thing up there?
Oh, yeah, sure, Dr. Adriel. So I graduated in 2018 in Punjab, Ludhiana, and I was a localite. I wasn't a hospitalite, and more or less we treated patients from the state of Punjab. And I have 4 years of work ex post-graduation. I have worked in charitable setups and in private high-end practices. I have attended multiple conferences. I enjoy listening to speakers. That is one of my hobbies even. And um,
So if you don't mind me asking, what profession are your parents in?
so they both are retired government servants.
And what department was your father in, or your mother?
So he was into food supply and my mother was in irrigation.
Okay. And how many siblings are you?
One elder brother.
And what profession did he go into?
He works for an MNC in Ludhiana.
And what made you go into dentistry?
So my reason for going into dentistry was, firstly, during that time of my life, I wanted to stay close to home, and I was getting this college through the NEET application and everything that was local. I wasn't getting, as per my rank, I wasn't getting the college that was available in my city for MBBS. For MBBS, I had to move out. But for that very reason, and my family convinced me that BDS is a better profession for women, considering you don't have to go out for emergency calls, this and that, and other reasons. For other reasons, I stayed back.
Okay. And how was your experience during your 4 years? You said you like to go listen to conferences and speaker. Like,
Yeah.
how was your 4 years of dental school experience?
So the first 2 years, I liked it because it was more or less parallel with the MBBS program. In the third year, I found it slightly harder to stick to the course. I planned to move out and start my journey for an IAS or IPS officer and start preparing for those exams. But it was only until fourth year when I entered clinics and I could treat patients. And I knew that I needed more knowledge and skill to treat patients. That's when I really got serious. That's when even my scores were, getting better. My grades were getting better. So in my fourth year, I became extremely serious, dedicated towards dentistry, and then I never looked back. And it was only through listening to my HODs, because they would take more lectures and they were more experienced. I liked the way they knew things in depth.
What subject or what specialty of dentistry or which HOD, which subjects or departments chair influence you the most?
I would say endodontics and oral OSMF, oral surgery.
Okay. And when you said you like to go to like conferences and stuff, like, did you go out of US or out of India or inside India?
I did many in India, in different parts of India, and then I did a few in the States.
Which conferences have you attended in the United States?
So I did the Greater New York, and I did a few like private courses, like hands-on workshops by a
Which
few
ones?
doctors.
Which ones?
So there's this doctor called Stephen Phelan. I did his courses. He's very famous as well. I did a few of his courses.
What were the courses about, Doc?
So they were mostly related to implantology or basic dentistry. These are my core interests as of now.
Okay. And beside dentistry, what do you like to do?
I paint,
Okay.
and I usually listen to interviews or lectures, and I read.
Okay, I'm going into a little bit detail to ask, what kind of books do you read or any recent book?
So right now I'm trying to read more of administrative or financial kind of stuff,
Okay.
like stuff. Yeah.
Have
But
you,
earlier I read fiction.
are you in US right now?
No, I am a Canadian citizen.
Okay, so you're living in Canada?
Yeah.
Since when did you move to Canada?
2 years ago.
And what have you been doing in Canada?
I have been assisting at a private practice in Canada for 2 years.
Okay. All right. And anything beside painting and okay. So all right. So you pronounce your name Surbi?
Surbi.
Surbi. And what's your full name, Doc?
Surbi Pathak.
Okay. So if I have to give an answer, I would say, okay, ask me, tell me about yourself.
Yeah, please tell me about yourself.
Thank you for giving me this opportunity. My name is Surbi Pathak. I was born and raised in the northern part of India. And since an early age, I was very much inclined in reading books and exploring new things. And that always gave me fascination to explore something new, plan for something new, or I wanted to learn in a three-dimensional manner where I can grow in my personality and in my knowledge of the field. And I was fortunate that my early exposure to dentistry taught me that it's a part or a specialty of medical field, but it's very much hands-on and it kind of overlaps with a sense of art as well while connecting to human beings. So that was an encouragement for me that got me into a really good dental school in North India, where the part of India where I was growing up. And during that time, I felt I was really doing good. But during my third year, there was a phase of my life where I thought maybe dentistry wasn't for me. Things were getting hard for me in dental school. But one of the things that really helped me was my mentor of my faculty of endodontics, because he counseled me a lot and made me understand that dentistry is far bigger than what we see in the dental school. And in order to get a grasp of it, I should keep my horizon open. And he encouraged me into taking more conferences, listening to more speakers, clinicians, and understand dentistry in a bigger perspective rather than just looking at the tooth that is being taught during our third year. And because of that counseling, I was able to attend multiple conferences in United States, like Greater New York Conference, and I attended hands-on courses in the United States as well. But after my graduation, I felt I wanted to pursue dentistry in North American region. I wanted to move to US to pursue advanced standing dentistry. And after practicing for 2 years, I was able to migrate to Canada, where I've been living for over the past 2 years, working as a dental assistant. And in my free time, I like to read books. I like to paint, and I like to listen to a lot of dental podcasts whenever I get the opportunity to. So somewhere along the lines from the information that you gave me, that's how I would create that tell me about yourself. Again, this is just a suggestion. What I'm saying is just a suggestion. When you go through this recording, you pick and choose the things that you like and you create something new of your own. Does that make sense?
Yeah. Thank you so much, Dr. Adriel.
Good. So for the rest of the people, I know everybody was getting bored during this time but what I'm trying to say, the reason I'm doing this example is that if you go down your life and you start writing the important things in your life, like you write down all the important things that you feel you have gone through in your life, and then you connect them in a story. So in her life, her curiosity and learning was one of the ways that is connecting. Like she's somebody who wants to learn more, who wants to explore. So when I was listening, that was the key thing I could grab, and I can connect her whole story or her whole journey around that. So everybody's story has something like this. So in your case, you can start writing down the points, and it takes some while. So you start writing down that, and you go from there. All right. Now let's come back to ethical scenarios. All right, because that's an area I wanted to discuss. So anybody has any questions right now? Dr. Manpreet,
Yes, doctor, I have a question.
Sure. Sure.
How can we answer like diversity related questions? Like I have asked a question in an interview, like what do you think about diversity? How's your view on diversity?
Tell them I don't like them.
Yeah.
Well, it's an honest answer, right? So the way you answer any diversity question, obviously we all say that diversity is good, but the point is the real answer is you have to tell your own personal experience where you dealt with diversity, where you worked with diverse group of people and you learned something out of it. So people who have been to US or Canada, they can always mention that moving to United States in 2022, I got to not only live in a city like New York, where I got to do dental assisting, but even being in the city and meeting a lot of diverse population, eating a lot of different foods, learning and listening to so many different languages. One of the things I've learned is that there's so much common amongst all human beings, regardless of which culture or ethnicity they are coming from. And along with that, I think a society's value is based on how much more diversity they have, because everybody brings a certain level of gift on the table that makes us unique. And I think having that diversity and that uniqueness allows us to be a stronger team player. So you have to give some kind of example from your life where you worked with diversity and say how you found it to be an important part.
Yeah, okay.
Right.
Thank
So
you so much.
somebody in the comment asks, if we have a master's degree back home, how should we answer why DDS not residency? So to be honest, you can always, like I was doing residency in fellowship in oral and maxillofacial surgery, and they asked me, do you want to do oral surgery now, or why not, like something like this? And I said, well, as of now, I feel there's so much to learn about general dentistry, and to understand the foundations of general dentistry is very important. And at the given situation, I'm much more inclined to learn the foundation of general dentistry through DDS. And if given the opportunity later on, I can always look into the preposition of pursuing a specialization if I want to. So they would never punish you for saying that I believe I want to build a stronger foundation in general dentistry right now. That's how I would focus on it. All right, Dr. Safa, you wanted to ask something?
Yes. What about if they ask us about a gap between graduation and coming back to dentistry?
I don't know if you've seen a video of mine. There was, when I started working with candidates in 2019, I had somebody who got accepted to TUF with an 8 years of gap, no clinical work, no shadowing, no volunteer work. With a lot of female, they are aware people have families, people have kids, people have responsibility. And I don't think you need, if that's one of the case, you can always tell in all honesty that you were taking care of your family and managing that. And now you're at a situation where you can manage the house and circumstances where you can study without any interruption. But you can also say that you're at a point of your life where your family is much more supportive of you to get education in dentistry now.
Thank you.
Okay. All right. Any other question, guys? Okay. One of the questions, ethical questions, any ethical questions, rather than me telling you because I've shared already, do you guys have any ethical questions that you want to discuss? Okay. All right.
So I was asked a question in Kira interview that if a patient doesn't accept your treatment, how are you gonna treat the patient or handle the patient?
I think I just made a video on that 2 weeks ago. This is very common question these days. It's being asked everywhere. So if I was in a situation, I would say, Well, yes, there has been examples in my personal life where a patient did not accepted a treatment plan. You can give number one example that I had a patient who did not wanted amalgam filling because they believe that amalgam is toxic and that can cause neurotoxicity to their body. So what I did is I sat down with the patient. I explained to them the benefit of or the pros and con, advantage and disadvantage of amalgam and composite, and I told them as of now there's no given data that shows 100% proof of amalgam being toxic. But as a doctor, I provided him different treatment option. He can get amalgam filling, he can get composite, and or he also has the option to do nothing. All right. And by the end of the day, as a professor, as a doctor, we are supposed to educate our patients, but it is the patient's autonomy to accept treatment that they want. Make sense?
Yes, sir.
One,
Thank you so much.
sure. Give me one. Yes, Dr. Muskan, you were asking something.
Good afternoon, Dr. Adriel. Thank you so much for today's seminar. So my question is actually more on a behavioral question rather than an ethical question. Can I ask it?
Yes, sure.
So the question is about conflict resolution. So without being monotonous in a interview, which is of course for getting an admission into a dental school, how can we answer this question without every time bringing it back to dentistry?
Can you give me an example where you had a conflict and you resolved it?
Unfortunately, I cannot remember anything that
Okay.
maybe it
Let
could
me
be a
give-
match of basketball, but I don't remember
Let
much.
me give you an example. So the reason schools ask you about conflict resolution is because they know when you will be studying as a DDS student, you're going to get into a lot of trouble. There will be other students fighting you over patients. There will be issues going on. God knows, like a lot of things happen during that time. So what they do is they want to see that are you a team player or a person who can manage conflict and resolve it without breaking somebody's skull. All right. That's something they are trying to figure out. So the way if they ask me, I would say, well, yes, there have been times when I was in a conflict or in a difficult situation, whether it was master's program where we were working in a group of 3 people and the other 2 people stopped talking to each other. They had a fight over something that I was not aware, and they stopped working, they stopped communicating, and they were not doing their part of the work. So what I did was I reached out to them separately and I asked them what is going on. And I tried my best to resolve their issues so we can complete our assignment, but they were not willing to sit down and talk. So what I did is that I asked them that we can break down the assignments into 3 different segments. They can do their part of the work and send it to me. All right. They don't have to communicate. They don't have to talk with each other, but they can submit their part of the assignments and give it to me, and I can compile it and submit it to our faculty or the professor. And that's how I was able to complete that assignment without creating more issues or a conflict between the team. All right, that's one example. You can also talk about a patient who was very aggressive and was when you were about to numb the patient, or there was this happened to me once that there was a husband who was really pushy that we should extract her wife's teeth right away. He wanted it to be get done. And the wife was having a vasovagal. She was like like she had a high blood pressure. And I got to the point where I was very much annoyed, and I sat down with the husband and I said, listen, if you are in so much of a rush, you can pull it yourself, but this is a live human being. There are certain responsibilities, certain issues that goes along with it. There's a cardiovascular system, and if I try to give this person epinephrine or an injection, her blood pressure is already too high. So first of all, you need to calm down and you need to let us do our job. So for the sake of interview, I would say that I explained to them that they need to be supportive of their wife's condition rather than pushing the doctor and the patient to get the job done. This is not the right way to support your family. And the next thing was I discussed with the patient that they should not be under pressure to get the treatment done fast. I prescribed the wife an antibiotic, gave her a couple of days so she can be mentally relaxed, and then extract the tooth. All right.
Understood. Yes.
Yes. So any other question, guys?
Sir, I do have one more ethical question.
Yep.
So the question was, the patient comes to you and wants an aesthetic treatment for the upper jaw, but when you examine, there's a lot of underlying disease and issue. They have probably cyst or mobile teeth. How do you deal with patient?
Well, first of all, I would like to get that patient's medical condition, then their overall circumstances. I would like to know about the conditions, systemic conditions they have. And then I will try to open up a radiograph and explain to them, showing them a digital scan or a radiograph, that they have a lot of multiple infection that is going in their teeth, in their jaw, and that is affecting their overall health, not just their oral health or the teeth, but also their systemic health. And in order to fix it, we would have to refer them to the specialist in order to evaluate the cyst and take care of it. And once that is taken care, then we can move forward in rehabilitating the teeth and giving them a better smile and a better function for the future.
Understood, doctor. Thank you so much.
Sure. Okay. Anybody else have questions? Okay. All right. Now I'm gonna not taking too much of the time. I wanted to focus on ethical scenarios. So in ethical scenarios, if you've seen, like I posted some videos, one of the favorite questions that the schools like to ask will be, and I have to touch upon it, and this is one of the most repeated questions they can ask you if one of your friend is cheating in an exam. Now they can say your best friend or your roommate is cheating in an exam, what will you do? Or they can say one of your best friend or your roommate came to you and told you that they have all the past papers from the previous year and they are using them to get good grades. What will you do? In both of the situation, you can talk to your friend, you can tell them that whatever you're doing is wrong, is an ethical misconduct. But if you continue to do this, first of all, you need to go and inform your faculty yourself. All right. You need to go and inform them. If you don't do it, otherwise I will have to report you, because it's my ethical duty to report any misconduct that is going on. All right. So the thing is, in ethical scenarios, you will always get one question where somebody is cheating. And what the schools want to hear is that you will say, I will inform this to the faculty or the concerning authority regarding this misconduct. All right. This is usually their hot. Now they can change it a little bit. They can mold it differently. They can make the situation a little bit different. But whenever you hear cheating in an exam or coursework, you have to say that I will inform the faculty. That's the school wants to hear, and they have zero flexibility on this. All right. Now, the second type of question they can ask you is somebody is not following the rules of the school. Cheating is one thing. But now, for example, if somebody is not wearing the right kind of scrubs, or somebody is not giving oral hygiene instructions to the patient, or somebody is not wearing, like, not using the right instrument. Now, these kind of problems are not equally serious as cheating would be. Like, just because somebody was wearing a light blue scrub rather than a navy blue scrub, should I go to the dean and inform it right away? I don't think so. I would first talk to the friend, to the colleague, to the student, is that according to the school regulation, this is the color of like this is the code of conduct or what the color of scarf that the school require us. And I would encourage them to follow it, like wearing N95 or something like that. But if the student continues to not follow the school rules and regulation, then I would like to inform them or inform the concerning authority regarding it. So these kind of questions, they can ask you, somebody is not giving oral hygiene instructions, somebody is not being polite to the patient, somebody is not wearing the right scrubs or not wearing safety goggles in the lab, something like that. In that kind of situation, you just guide them, like, and if they continue to not follow the rules, then you inform to the faculty. All right. Any questions regarding this? Dr. Patel, you want to say something? All right, this is a very quiet group. Okay. So this is the second kind of question they can ask you. All right. Any other questions from ethical scenario?
Yeah, I have one question.
Mm-hmm.
So this question was asked in the interview: if you have an exam coming up the next morning and at night your friend knocks at the door and says his mom is diagnosed with cancer, what will you do with the situation?
So if you're studying at night and your friend knocks at the door and tells you that they got this news, first of all, I would ask my friend to come inside. I will give them a cup of water and I would like to know their overall how they are doing, if they are in the right state of mind, if they are doing fine. I would like to comfort them. And one of the things I'll do is, if I have done my preparation and I feel confident that I'm good in the exam for tomorrow, I would sit down with my friend and help them. But if I feel I'm not in a and I will also talk to my friend and ask them if they are going to attempt the exam tomorrow. That's an important question. I want to have a conversation I want to have with my friend. If they are not going to do it, I would encourage them to email the faculty right away, inform them of the circumstances so they can get an excuse for the exam and perform it later on, right? But either situation, if I've done my prep, I'm more than happy to sit with my friend, go talk to them. But if I still have to study, I would help my friend and tell them that out of this time, I'm very much sorry to hear this news, but let me get back to you and have detailed discussion with you tomorrow regarding this. And if you need more help, you should call your family or your faculty as of now. But I would like to reconnect with you early morning tomorrow. All right. So you have to break it down into examples. If that person cannot study for tomorrow's exam, he needs to inform the faculty. If I've done my part of the exam, I'm confident I can help them. But if I haven't done that, then I would ask them to let's reconnect tomorrow morning and discuss in more detail. But if that person needs help, he should reach out to the school faculty or some friends and family if they have any urgent need that needs to be taken care. Like if they have lost their senses, they are crying a lot, need some medical attention, then they need to inform the school authority or a family member. Does that make sense, Doc?
Yeah, that's a very good answer. Thank you so much for elaborating.
I had a question similar to this. They asked me in Colorado's interview, they said, well, you were studying at night and one of your roommate who have been doing party throughout the semester comes in and says at that night that, can you teach me for tomorrow's exam? I haven't studied. So at that given time, I told them, like, if I had already prepared for my exam, I would love to help him because that way I can revise with him as well. But if I have not studied and I still need to study on my own, then I would have to apologize and ask him that I will be able to help at this time. But once the exam is done, I would like to have a conversation with my friend and tell them that if they want to be a good clinician, if they want to graduate from their DDS program, they have to take their education more seriously. And if they need help, they should reach out to the school faculty and look for counseling and help regarding their education. All right, makes sense, Doc?
Yes.
Okay. So guys, any other questions?
Yes, sir. I have a question.
Yes.
So I got a question asked. So what is a bad thing that you can do to a patient other than touching them?
There's a lot you can do them. You can misinform them, not educate them. I think one of the biggest as a clinician we can do is not informing them regarding their oral health situation and the possible consequences that can happen to them. So not educating them about oral hygiene instructions, not educating them about the disease that's going on, and not providing them the right level of treatment.
Okay, yeah.
All
Makes
right.
sense, Doc. Thank you. And one more question, but
Yep.
this is a general question. So if an interviewer asks the questions, there most of them says that we can take a 1 minute pause and think. And where can we look at during the time while we are thinking? Do we need to look into the interviewer's eyes? But I don't think that would help us to think.
It's up to you. There's no right and wrong. I usually, if I have to think, I would take a cup of water and look in the glass meanwhile while I'm thinking.
During the interview?
Well, you can drink water during your interview. They won't punish you for drinking water.
No, but I didn't have water beside me, so yeah.
So I'm not talking about the past because we can't change the past. I'm just talking about the future.
Yeah,
If
exactly.
we have to think at that, what's bygone is bygone. So I'm talking about in future. Like if I have to think, I usually use water the best way because that way you can drink water and you're thinking, but you can look anywhere. There's no hard and fast rule about it. Most of the time as human being, when we are thinking, we tend to look at the roof. Try avoiding that, but there's no right and wrong answer. You can look anywhere you want to while thinking.
Okay, doctor. Thank you. I know it was a basic question, but still I wanted to
No,
ask.
no
Thank you.
problem. Any other question, guys?
Hi, doctor. I have a question.
Yep.
Yeah, sorry, last time I got disconnected. So this is general question. If interviewer asks that in clinical environment, like where you are working, how your colleague will criticize you? Like, give me like 3 points, how they will criticize you. Then we need to explain each point, or we just have to.
Was this asked to you in an interview?
Yeah.
What was the question? Was it word same like this?
Yeah, so they said like you are in clinic, right? I said yes, like working as an assistant.
Okay.
Then said in your clinic, how your colleague or staff will criticize you.
So
Give me
what they are asking you is, tell us about 3 areas of improvement which you feel that you need as a dental assistant. That's what they are asking you. So they are asking if there was 3 criticism your colleague have to give you in the clinic, what would they be? So if I would have to say this, if I'm a dental assistant and they have to ask me this, I would say, well, I believe they can criticize me or give me a feedback that maybe I need to take better 3D scans. That's an area. Second thing is learning the coding system better when we are doing treatment plan or putting in treatment plan for a doctor. So learning the treatment plan. And sometimes my angulation of digital x-rays, making sure I angle my bite wings at the right way so I can get clear contacts between the tooth. That's an area of improvement where I might get criticism.
Okay.
Yep. So these
Okay.
are, but they are asking you as a dental assistant, and these are the areas.
No. Yeah, but I thought their words were something based on my behavior or my.
Again, no, that's what I'm trying to say. I've never heard this question in 4 years, and that's why I'm asking, what was the exact words? If you
Exact
remember,
was like I'm a clinical in charge as well. That's what they're asking. What are your duties? So I said I oversee clinical teams. Also I train dental assistants as well as front desk staff if needed, and the other things I handle as well. So they said like how your colleagues will criticize you then, like.
so if now you change the whole thing, because first you told me you were a dental assistant. Now you said you're the in charge and you're.
I mean everything.
So,
yeah.
So
is
here's the thing. Let me tell you. First, I gave you an answer like you're a dental assistant. Now you said if you're a clinical in charge, then I would say, well, my colleagues at this given time can mention that I'm a little bit too disciplined. I'd like to make sure that things are done very properly for our doctor and for our patient care, and they have to be done punctually. So I usually ask all the staff to arrive there on time so we can have a morning huddle. And one criticism they might say is that I'm a little bit strict when it comes to time management.
yeah.
All right. The second thing you can say is that one area where I feel, are you able to hear me?
Yeah.
One area where I feel they might criticize me is that I tend to be very tedious when it comes to cross control contamination, because I believe that's an area which should never be looked upon. So that's also an area where they might criticize me.
Okay. Thank you so much. Yeah, these are good points.
Yeah. But this is not a common question. I haven't heard. If you don't mind me asking, which school was this?
Yeah, Colorado. They ask me all clinical questions like what are your duties in clinic?
So
And
here's the thing I tell people is that however you start, you're like, if I'm not talking about you now, I'm just talking generically. If you start in your tell me about yourself, or in your early introduction, you emphasize on one of your roles, like I was a endodontist back in India, or I've been working as a dental assistant for 8 years and I'm in charge of the whole clinic and I train people, then they will continue to ask you questions from whatever you told them.
okay, so here
And
is the thing. I did not mention this in Tell Me About Myself. I did
Mhm.
not mention this. I don't know, like something came up, but I don't remember.
It could be
I
a
think they,
personal statement, could be a resume. And one
yeah,
other thing is, if you feel like they are probing into something that you don't want to discuss a lot, you can actually deviate the discussion to a different topic. There's a very, it's hard to explain on like in this situation, but you can always change the discussion.
Mhm.
Like if I'm sitting in an interview and somebody's an endodontist and they keep asking me questions on root canal, I will try to switch it and talk much more about restoration or about surgery or about ortho, because I don't, there's a very smart way to gently just step away and change the topic a little bit, because you're going down a rabbit hole where you're going to get stuck, and that's just something you learn out of practice. But if you feel like they are grinding you too much on one topic, you might want to switch or give an example or a story that might switch the discussion.
Okay, sounds good.
Yep.
Thanks.
And sure thing, doc. Any other question, guys? It could be an ethical scenario or any other thing that you guys want to ask. The reason I'm not going into the basic details, because in the last interview workshop that I did, I've gone through a lot of minor details and I just don't want to repeat it all over again. But if you have any questions, you guys can ask me. Otherwise, I'll stop the recording from here. And then if somebody wants to ask something off the recording, they can.
There is one question.
Yep.
It was asked in an interview, like you delivered a denture to a full denture patient. He was very satisfied the day you delivered the denture, but at night he calls and he's very angry about it. How will you go in that situation?
Well, in this situation, if the patient called me at the emergency line that he's angry about the dentures, I would encourage him that he can take it out, put it in a cup of water, and do some lukewarm water rinses. If he's in pain, he can take a Tylenol or any anti-inflammatory for that night and try to rest. And in the early morning, I would encourage him to come for the first appointment, and we can do a clinical exam at the denture and his oral cavity and make adjustment as needed. And from there, we can see whatever adjustment are needed in the denture, which most of the time dentures need adjustment, and we'll try to take care of his pain and his problems moving forward from there. And usually I tell people with denture patients that we are trying to replicate, or we are trying to rebuild something that God made, and this is a human trying to work on it. So there's always going to be problems. So this is a teamwork. So we need to work in patience when we are trying to fix it. But eventually we will get you to a point where you can eat and have a better life.
Yeah, sounds good. This is a very good answer.
Yep. Any other question, guys? All right.
Doc, I have a question.
Sure.
And how can you answer a question like what motivates you?
Well, it depends on your life. You can mention about some early part of your life that gives you like it depends on your life. Like this is a point where you have to relate some personal story, something of a setback in your life, some artwork, something that encourages you to move forward. Like somebody can be, people say that learning encourages me new something new in life, learning new stuff, that's a source of encouragement and that pushes me. Some people can say I've always had a, growing up as a young kid, my parents invested in my education a lot, and especially as a girl coming from India or Pakistan, it was a huge challenge to become the first female doctor of the family. But that's have been a source of encouragement for me to move forward in pursuing the dreams that I want to reach.
Okay, great. Yes, sir. Thank you so much.
All right. What can we answer for tell me about a meaningful experience? Well, these denture patients can be really meaningful in clinical practice because a lot of people, there are people who haven't eaten anything with teeth for years. And once you give, like I had the best experience when you give people like dentures or relieve their pain, sore spot, like their ice chain, because now they can bite without hurting themselves and they are grateful. Sometimes people start crying looking at a smile again. So that could be that. For me, I had a patient who had been in pain for like 7 days over the Christmas, and he came in. I extracted the tooth, and he was so much happy that finally that pain and infection is out of his mouth. So you can give any example like that, even for endo, for some veneer cosmetic procedures that you did. All right. So any other questions, Doc? All right, I'm gonna stop the recording. If anybody wants to ask some question, still we can. Otherwise, we'll stop the session from there. I hope I was able to help you guys. I know there's a lot of people who didn't spoke anything. I don't know if they're present too, but I'm gonna stop the recording and you guys can ask anything if you want. And I might use some of these things to post on my social media if you're comfortable, all right? So I'm gonna stop the recording up here.